GLP-1 medications like Ozempic, Wegovy, and Zepbound are changing lives. But lately, headlines have been circulating about increased fracture risk, bone density loss, and higher rates of gout. So what's actually true? Are GLP-1s harming your bones, or are we misunderstanding what happens when people lose weight rapidly? Let's break down what the research shows, and most importantly, what you can do to protect your long-term health. Bone density is influenced by body weight, mechanical load, hormones, nutrition, muscle mass, and exercise. When someone loses weight quickly from any method, bone density can decrease. This is not new, and it's not specific to GLP-1s. Now here's where things get interesting. Some research suggests that GLP-1 receptor agonists may have a neutral or even protective effect on bone metabolism. They may reduce bone resorption, and some studies in people with type 2 diabetes show lower rates of osteoporosis. But a newer observational study of over 146,000 adults with obesity and type 2 diabetes found about 4% of GLP-1 users developed osteoporosis compared to just over 3% of non-users. That's roughly a 30% relative increase. Gout rates were also slightly higher, 7.4% versus 6.6%. Now, here's the key. This study was observational. That means it shows an association, not causation. Researchers didn't know who was exercising, who was strength training, who was eating enough protein, who was supplementing vitamin D, or how much weight was lost. That context matters. So why might bone density drop? There are two main theories. Theory 1, mechanical loading. Bones respond to stress. Heavier bodies place more stress on bone, which stimulates bone formation. When weight drops rapidly, mechanical load decreases. Think of astronauts in zero gravity. Without load, bone density decreases. So is this a drug problem or a rapid weight loss plus reduced load issue? We don't fully know yet. Theory 2, nutrient intake. GLP-1s suppress appetite. Some people unintentionally undereat. Protein, calcium, and vitamin D, those are critical for bone remodeling, muscle maintenance, and fracture prevention. If intake drops too low, bones can suffer. This isn't a medication failure. It's a nutrition strategy issue. We've talked before about lean body mass loss on GLP-1s. That includes muscle and bone. Muscle protects bone. Resistance training preserves muscle, maintains mechanical load, and helps prevent bone density decline. One study published in JAMA Network Open, the Journal of American Medical Association, found that combining a GLP-1 medication with structured exercise preserved bone density, while those who did not exercise saw decreases. That is huge. This tells us lifestyle is not optional here. Now let's talk gout. Gout is caused by elevated uric acid levels. Rapid weight loss can temporarily spike uric acid, regardless of how the weight is lost. In the study, 7.4% of GLP-1 users developed gout. 6.6% of non-users did. That's about a 12% relative increase. Again, not massive, but real. This is likely related to rapid fat breakdown, temporary metabolic shifts, possibly dehydration, and possibly diet composition. This doesn't mean GLP-1s cause gout. It means rapid weight loss can increase risk in susceptible individuals. The FDA label for Wegovy includes a fracture warning. In clinical trials, 1% of women on Wegovy had hip or pelvic fractures compared to 0.2% on the placebo. Important? This is a small absolute number, but it tells us bone health should be monitored, especially in postmenopausal women, older adults, those with low baseline bone density, and people losing significant weight. This is the most important section of this video. If you're on a GLP-1, you are not powerless. Here's how to protect your bones. Number 1, lift weights. Resistance training is non-negotiable. It preserves muscle, bone, and metabolic health. Even 2 to 3 sessions per week matters. Number 2, prioritize protein. Aim for adequate protein daily. Muscle preservation protects bone. Extreme calorie restriction without enough protein can worsen bone loss. Number 3, get enough calcium and vitamin D. Talk to your provider. Consider checking your vitamin D levels and dietary intake. Number 4, consider a baseline DXA scan. If you are over 50, are postmenopausal, have risk factors, or plan long-term GLP-1 use, a baseline scan gives you data, not fear. Number 5, avoid extreme rapid loss of weight. Faster is not better with these drugs. Gradual, supported weight loss is metabolically safer long-term. Here's the bottom line. GLP-1 medications are powerful tools. They reduce cardiovascular risk. They improve diabetes outcomes. They reduce obesity-related mortality. The key takeaway from this research is not panic, it's refinement. Weight loss is not just about the scale, it's about muscle, bone, strength, and longevity. If you're using a GLP-1, the question is not, is this dangerous? The better question is, am I supporting my body properly while using it? And if you are, you can absolutely pursue fat loss and protect your long-term skeletal health at the same time. If you found today's video to be helpful, don't forget to like and subscribe. And if you're taking a GLP-1 right now, what's one habit you've added to protect your muscle or bone health? Let me know in the comments. Thanks so much for watching today, and I'll see you in the next video.